Anyways, that is all to say that joining us now and another major part of this show and our growth and success is our friend Ben Burgis. He's author of the indispensable book, which you must order now. Give them an argument, Logic for the Left. He also has an excellent Patreon page, which I subscribe to. You should as well. And he teaches logic at the university level, even though he doesn't know where it comes from. Ben Burgis is here with the Debunk. I want to go to mockery really badly.
I will.
So please go.
Okay.
You got to restrain me. Debunk all of it. Logical analysis. You're going to show us how to argue that. Go.
This is based on data.
This is based on data.
Countries. There's abundant evidence that at this point that's bullshit. Breaking down these right-wing arguments and looking at how they're supposed to fit together.
Okay, break it down. Break it down. Break it down. Ben Burgis, thanks for being here.
Thanks for having me. And that song is fucking excellent.
Whoa! Yeah!
Ooh.
Fucking A.
Outlaws.
Someone took his beta blockers today. No, thank you, Ben. Doesn't that feel better?
Yeah, I mean, I thought that was always clear. That was my position. But, you know, I thought I'd make it more explicit.
You're breaking up, Ben.
Yeah, I always thought that was clear. That was my position, but I thought I'd make it more explicit. I'm a big fan.
All right, very good, Ben. Well, actually, today we have two pieces of highly questionable. We have more questionable healthcare news. That's Kamala Harris, but there is nobody in the Democratic primary. I mean, and I'm just forget Hickenlooper and Delaney. They're annoyances, right? Joe Biden is the Democratic primary frontrunner, as much as we hate to admit it, right? He is. He and his campaign are lying so continuously, fear-mongering and distorting so continuously about healthcare that it's essentially the Biden campaign's cottage industry. Set this clip up for us, Ben, briefly, and then we're going to debunk it.
Yeah, so Biden is unfortunately currently the front runner, which of course, you know, I mean, look, I don't have a crystal ball. He could win the primary.
We do have a crystal ball. She's on the show
election.
regularly. She's one of our collaborators.
You know, these things are all possible, but it's also very possible, given his history, he's going to crash and burn, and it would be nice if that happened while there's still a chance to have a different nominee.
Right.
And
yes.
Of course, you know, he has Bernie Sanders breathing down his neck with a much better program. Since Biden doesn't have a good program of his own, he has to resort to some pretty shady arguments against it, which is what we're going to see him doing in this clip, using as a prop a retired union worker who wants to keep their plan.
All right, let's take a look.
The day the Affordable Care Act passed into law, I cried tears of joy because I knew my family and friends were going to receive medical care they so badly needed. I also have relatives that have been diagnosed with a chronic disease, and at the time they were diagnosed, their health care was running out, and the insurance providers would no longer let them get the prescriptions they needed because they were at an unbelievable price. The Affordable Care Act came into law. They were able to get the medical care that they needed. They continued to live a full life. My husband and I worked for a very long time. We are now retired. However, the length of time we worked earned us benefits that we can live the rest of our lives with. One of those is our private medical insurance. I have my own private insurance. I don't want to lose it. My husband and I worked for over 30 years. I feel we earn that benefit. And that's why I prefer to keep the Affordable Care Act. We build upon it, bring in the private insurance, and move forward. I like what I have, and it means a lot.
Well, stay healthy along. Hope you don't need it. Hope you don't need it.
That's right. I know. Thank you, Vice President Biden.
Okay, Ben, it's all right.
It's horrific.
It's not well done. I'm thinking of my Simone Sanders conspiracy theory, but go ahead, debunk that.
Yeah, So at the beginning, the film is painting a very grim and very accurate picture of what existed before the Affordable Care Act, which is important because the argument, such as you've got one against Medicare-For-All there, in favor of, just keeping the ACA, maybe adding, something that you call a public option that would still be structured in terms of premiums and probably means tested and et cetera. The argument is, well, the ACA is good. It was a big improvement. Therefore, you wouldn't want to lose it, would you? And this person has this health care plan that's good, and they wouldn't want to lose it. And, of course, there is a massive equivocation at the heart of that about what it means to lose either of those things. And so when you talk about how great it was when the ACA passed, and, of course, the ACA, by the way, did definitely save some people's lives. It was an improvement of what we had before. But it's also a mixed bag, and in fact, it has a provision in it, it had a provision in it, the Cadillac tax is designed to discourage exactly the kind of health care plans that she's talking about in this ad. So Biden's concern for, preserving those plans didn't seem to exist when they were talking about including that in the ACA.
No, it didn't end up in the ACA because of pushback, but it was in the initial plan that the Obama-Biden administration put forward.
Yeah.
Right.
So exactly. Yeah. So but even ignoring that, right? Even ignoring the ways in which it is a mixed bag, it's unambiguously positive rather than a very complicated, very ambiguous kind of Rube Goldberg regulatory contraption. Okay, well, there's taking it away in the sense of going back to what we had before, and there's taking it away in the sense of making it redundant by giving everybody an improved form of Medicare. And once you make that distinction clear, once you disambiguate those two options, that part of the argument just disappears. The other part of the argument is she's got this great plan, so she doesn't want to lose it. And the implication is, President Bernie Sanders got us Medicare-For-All. We would lose this great plan that she's got, and so why should she have to give it up? But again, there's an equivocation there, because does lose it mean that it would that her insurance would no longer be paid for by her current insurance company, or does lose it mean she would no longer have insurance, that she would no longer, for example, get to see the doctor that she sees? That's one of the main things that people are concerned about, very rightly, when they hear the phrase losing your health insurance. Like we've talked about before, everybody is kind of trained on an almost Pavlovian level to be afraid of hearing that combination of words, because everybody's experienced how bad it is to have one private health insurance plan be replaced by another private health insurance plan, so you have to find a new doctor. But of course, under Medicare-For-All, every doctor would be in plan, so she could still see her doctor. So really the only remaining shred of anything there is to the argument of this video, and the way that some people on Twitter were trying to defend this, would be by saying, well, she's not going to have, if she has a really, really good plan like what she's talking about, it's not going to be quite as good if it's replaced with Medicare-For-All, because then maybe the waiting times will be longer. And this is linked to one of the popular anti-M4A talking points, which is the claim that, there's a physician shortage in Canada, for example, and so we'd have one of those if we had Medicare-For-All, which is not really true, by the way. The number of physicians per capita in Canada versus the United States is like 2.2 versus 2.4. It's really in the same ballpark. To the extent that there's a problem, it's because with general practitioners in Canada, which does, increase wait times, that's because doctors are more likely to go into very specialist fields because it's easier to repay their med school debt. So if you want to solve that problem, there is another item on the Bernie agenda for that, right? You have free public university, including medical school. And just the last
By the way,
point on that,
and debt forgiveness as well.
What's that?
And debt forgiveness as well.
Yeah. Yeah, debt forgiveness as well, absolutely. Debt forgiveness for existing doctors, so they don't have to worry as much about having to pay off their med school loans, which means that people are able to be general practitioners. They don't feel pressured to go into more remunerative fields, the same way that debt forgiveness would allow lawyers to do more public interest things rather than having to go into big corporate firms. And then free tuition for future lawyers so they don't have the debt in the first place. And if you want proof of concept for that, if you're worried, if your big concern about Medicare-For-All is that we're not going to have enough doctors, if you want proof that not saddling people with this kinds of debt is going to be able to solve that problem, you know where it has a lot more doctors per capita than either the United States or Canada? Cuba. United States, 2.4 per capita. Canada, 2.2 per capita. Cuba, it's like 5.9.
Right. And I just want to add just also briefly, because this also implicates not only the lies that Biden is telling, but even the Harris plan, which is, I'll give her, I think it's a genuinely center-left plan. It's it's not Medicare-For-All. There's big problems in it, but it is better than what Biden is putting forward, right? But the big problem in her case, and what's totally unstated in everybody, whether it's Biden or Buttigieg or whoever else who's defending the ACA, is first of all, yes, it's cueing the terror that people have about healthcare, which is, scoring political points off of an absolutely barbaric and obscene system, which should be abolished root and branch to begin with, like Sanders advocates. But also, there's still tens of millions of people without healthcare under the ACA. And if you add, by the way, too, the amount of people who technically have health insurance but still avoid using it because of copays and deductibles, that adds another several million people. So this whole, it's not just that obviously this woman's in zero danger. In fact, the only danger she's in is of Joe Biden getting elected president and partnering with Republicans to cut Social Security and Medicare, which he and Obama advocated to do in 2010. But also that, so her healthcare will only get better with single payer. But all of the tens of millions of people that either don't have it or are still undercared today, if you, as an example, in Harris's plan, wait 10 years to phase it in, that's lives. I mean, all of these decisions are decisions that are costing conservatively tens of thousands of people's lives prematurely. So Joe Biden is fear-mongering, lying, distorting, playing on people's justified terror because of the moral obscenity of the market healthcare system, and he's going to cost people lives, along with Pete Buttigieg and everybody else who isn't proposing a clear, no bullshit plan like Sanders.
Absolutely, and there's a really a core moral point here that deserves to be kind of circled and underlined, which is that even to the extent that you do take the fear-mongering about wait time seriously, and as we've been discussing, the solution to that is more social democracy, not less.
Right.
But even to the extent that you do, well, right now, there's like millions of people that you're talking about who either don't have insurance at all or have insurance that they can't afford to use. So if they have a growth that could be something and could be nothing, they're not going to go to the doctor because they can't afford the copays. If you're saying those people should stay in the position that they are for the sake of people who already have health insurance having shorter wait times, then what you're saying is that some people should die so I can buy my way to the head of the line.
Right. That's it. That's purely what you're saying. Look, there isn't a third way position on this. There needs to be national health care that covers every single human being, period. Ben, as always, appreciate it. Of course, buy Ben's book, Give Them an Argument, Logic for the Left. It's something that I revisit frequently Check out his articles, including the great piece on Lula and Deflategate and Jacobin. And check out his Patreon page. Ben, thanks so much.
All right. Thank you, Michael.
Take care. You've just watched a Michael Brooks show video, and you can watch all of our full main live shows every Tuesday night at around 7 p.m. Eastern Time, and subscribe to get all of the clips you want. We're covering the globe. We're focusing on international relations, the intellectual dark web. We're having fun. We're doing deep dives with a lot of amazing guests. Of course, become a patron for the whole thing at patreon.com/TMBS, or subscribe to this YouTube channel and help us keep growing and get that content out there. Subscribe below.